Hello, doctors. So let's talk about confidentiality today. Confidentiality is a very important concept, not only in the exam scenarios, but also in real life because it's a basic ethical and moral principle for the doctors to follow. And people can lose their license for breaking confidentiality of the patient. So make sure that you have a good grip of this concept. All right. So, sometimes in exam situations, first of all, let me tell you that in 99% of the cases, you will maintain the confidentiality of your patient no matter what happens. Okay. There are few specific scenarios where you are required by law to break the confidentiality, and I will talk about them. But in 99% of the cases, you will maintain the confidentiality of your patient. So sometimes what happens in exam scenarios is that a relative comes inquiring about one of your patients. Okay, so it can be, for example, a lady is admitted with you and she has had undergone a few tests. She has undergone an MRI or CT or maybe some other test, and her sons come up and he says, how is my mom doing? And can you please tell me about her CT scan? What does the CT scan shows? Or it can be that a disgruntled parent comes to a GP clinic asking about why you have prescribed these medications to my kid. It can be oral contraceptive pills, it can be some other pills, but the father or the mother is very angry that why have you have prescribed these medications to my kid, and can you please tell me what was the indication for it? Or it can be or you can be in a psychiatry department and one of your mental health patient, their relative can come up, their mom or dad can come up, and they will ask that how is my kid going, what how is my kid doing, is he undergoing through depression, is there something that I should do to help, and things like that. So for these situations, first of all, when you are reading a scenario outside the cubicle, uh, there is one thing that you need to ask yourself. The first thing that you need to ask yourself is, am I talking to the patient in this scenario, or am I talking about the patient to a relative? Okay. So if you are talking about the patient to the relative, the next thing that you need to look for in the question stem is, do I have the consent of the patient? So they will write, like they will clearly write consent has been taken from the patient. But if this line is missing, then you need to know that the consent has not been taken. Okay. If this line is not mentioned that consent has been taken from the patient, then you will assume that it has not been taken. Okay. If the line is not there, okay, the next thing, the third important thing that you need to look for is whether the patient lacks mental capacity. So sometimes they do not tell you that the consent has been taken, but they tell you that the patient lacks mental capacity. So in cases where the patient lacks mental capacity, then you can discuss their medical management with their next of kin or their relatives. Okay. So three things that you need to look for. First, are you talking to the patient or about the patient? If you are talking about the patient, do you have the consent of the patient? If it's not written specifically in the scenario, look for mental capacity. Whether the patient, whether it is mentioned that the patient lacks mental capacity. If this is also not mentioned, then it means that you do not have consent and the patient does not lack mental capacity, so you are not going to volunteer any information about the patient to anyone. So there are some general rules to this scenario. The first thing is you are going to introduce yourself. You are going to check the patient, the relative's identity. You are going to check the relationship to the patient. You need to ask to confirm. You need to ask the date of birth or the address of the patient. All right. After this, some people do is they give a disclaimer right in the beginning of the station that, I'm not going to tell you anything about the patient, and because this is my moral obligation, this is ethical obligation, my hands are tied or something like that. But there is really no need for the disclaimer, because when you give this disclaimer, you finish your station there and then. Okay. But you need to keep in mind you have 4 marks for history here, 4 for interpersonal skill, and 4 for the management. So for the history part, what you need to do is you need to ask them everything. The general rule for this station is ask them everything, but tell them nothing. Okay, but don't tell them in the beginning that I'm not going to volunteer any information, because then they will not, uh, they will be really closed and they will not like tell you anything. So you need to take a full history. Okay, so start. I assume that you know about taking the history at this point, but start like ask them about how much they know about the patient's general health, the patient medical condition, how is the patient doing recently, when was the last time that they saw them, what medications is the patient on, um, what other medical condition, okay, some psychosocial history as well. All right. And then you ask them that what are their specific concerns about the patient? Have they tried talking to the patients first? Stuff like that. Okay. Then um, try to find out their concerns. What are they worried about? Okay. So maybe the patient is the patient's relative is worried about, for example, in case of where their kid is on some contraceptive pills, maybe so the parent is worried about whether the child is involved in any sexual activity, or maybe whether they are in danger. So you need to offer them solution in a way, like you need to talk in third person tone. You need to tell them that when a child this age comes to us for conception, we ask them a lot of questions, and we ensure to the best of our abilities that they are not in any sort of abusive relationship, they are not being taken advantage from. But don't tell them whether their child came or not, and like don't volunteer any information about the child itself. Okay. um the last strategy in this type of scenario is you flip the situation. Okay. Flipping the situation means that, for example, a son comes up to you and he asks, my mother is admitted and she has had a CT scan. Can you please tell me about the results? So uh, you tell them that you are to ask about the whole history. Okay. And then you tell them that the management part, that you cannot really volunteer this information to them. What you need to do is, first of all, you will go and talk to the mother, take her consent, and then you will come and explain everything to him. But the relative is really adamant, and he says that I really want to know, and I'm very worried, and I'm very anxious, and I'm very upset, and I really want to know at this instant what is my mother's diagnosis. Okay, so you flip the situation. You tell them that, Mr. Smith, if we the maintaining the patient confidentiality is our primary duty, and if we do not maintain the confidentiality, it will break their trust on us, and it will affect the patient care. And if someday your mother's come up to us and she wants to know about some informations about your medical condition, about your health, then we will also struggle telling her these things about your health, as I'm struggling right now telling you about hers. So that will do the job. They will understand. It will give them the insight that you will also not break their confidentiality as well when the situation flips. Okay, I hope I'm making sense. If there's anything that seems too complicated to you, you can just ask the question in the comments and I will explain. Okay, so there are some situations where you need to break the confidentiality, where it is your statutory duty to break the confidentiality and inform authorities. Okay, so some of these cases I will discuss now, and all of these cases are really very important for the exam. Many of them can come up. Okay, so you are required to break the confidentiality in cases of non-accidental injuries where kids and elderly are involved. So if a kid is brought to you or an elderly patient is brought to you and you really suspect that the injuries that they are non-accidental, it means that they are the subject of some form of abuse, then you need to involve the social services. Okay, no matter what, you need to involve the social services. You must involve the social services. Now, in cases of domestic abuse, where adults who have mental capacity are involved, for example, if a wife comes and you suspect that she has been involved in an abusive relationship, her husband is domestically abusing her, he's torturing her. In that case, you cannot break the confidentiality unless the patient consents. Okay, you will convince the patient, you will try your best to convince the patient to involve the social services, but unless she consents, you cannot involve. In that case, you just need to ask her, uh, do you have any kids? Okay, do you have any kids at home? If she has any kids at home and she is in abusive relationship, then you will also involve the social services, because there are kids there and they are also in a situation, like it is a situation which is harmful for them. And if a person is abusing his wife, there is a fair chance that he is also abusing are physically torturing his kids as well. So if the kids only are involved, then you will involve the social services. Okay. Otherwise, if there is only an adult involved in the situation, then you do not need to involve the social services. Okay. Then the second situation is communicable diseases. For example, meningitis, for example, gastroenteritis, polio, um, what else? Measles and tuberculosis. So in these situations, you will involve the public health authorities. Okay. The third situation is where a patient comes up to you and while taking history, you come to know that the patient was involved in a romantic relationship with a healthcare professional. It can be their doctor, it can be their nurse, it can be their psychologist, it can be their counselor, it can be anyone who is a healthcare professional. Then this is also a gross misconduct. This is also a gross professional misconduct. Okay, this there is sufficient for someone to lose their license. So you need to report this to your seniors. You cannot let this information go, and you will report it to your seniors. All right. So keep in mind the relevant authorities where you are going to report. So in case of non-accidental injury, it's social services. In case of communicable diseases, it's public health England. In cases of patients confiding some sort of relationship with the healthcare professional, you need to involve your seniors, and then the seniors will involve the relevant authority. For example, in case of doctors, they will involve the Journal Medical Council. In cases of nurses, they might involve the Royal College of Nurses. Okay, so then there is another scenario where there is sexual activity with a minor. So keep in mind that any sexual activity with a minor less than 13-year-old, even if it's with consent, even if the partner is also less than 13-year-old, you need to involve social services. Less than 13-year-old, no sexual activity, end of question. Okay, less than 13-year-old involved in any sexual activity, inform the social services. If the child is more than 13 years old but less than 16, so the age group between 13 to 16, which is the minor age group, you need to know whether it was with consent. If it was non-consensual, then of course you will involve the social services. Okay. But even if it was with consent, you need to determine the age of the partner and the position of the partner. Okay. So if the partner is older, for example, the partner is 18, the partner is 19, or even older, like 30. So you will involve the social services, because if your patient is minor and their partner is major, you will involve the social services. Or if the partner is a position, or if the partner is in a position of trust, for example, if the partner is their coach or their school teacher, or their doctor or anyone, then you need to involve the social services in that cases. Okay. So what some people do is they say they will involve the police. No, you will not involve the police. You will involve the social services, and then social services will do their job. They will collect the information and they will involve the police. Okay. The sixth and the last scenario here is a sexually transmitted disease. So you have a patient, he comes up with some symptoms of a sexually transmitted disease. You need to inform their partners, but I have put a question mark here. There's a reason for this question mark. Okay, so for example, a patient comes up to you, to your clinic, and he's complaining of painful urination. All right. And he's also complaining of some discharge, and you suspect that this is a sexually transmitted disease, and you tell him to go to the genitourinary medicine clinic to take swab, and because this is likely a sexually transmitted disease. So here you need to tell this patient that you also need to inform your partner. Okay. If the patient is reluctant and he says that no, I cannot, and this is embarrassing, then what you need to offer is, we have a partner notification program and you can do it for you anonymously. We will not mention your name and we'll just tell them to come and have these tests. But if the patient is still very reluctant and if he's getting aggressive and he start asking questions like, will you do it without my permission? Okay, then you really can't. You can't really inform their partners without their permission, because you need to know about their partner, right? You need to know the name of their partner. You need to know the address of their partner for you to inform them. Okay, so you will say that no, you will give them like the solutions, you will give them your what do we call rationale of you wanting to inform their partner. You will tell them that because this is a communicable disease, and as you have this disease, we are also concerned that your partner is also having this disease. And even if you get treated and your partner does not get treated, then there is a very high chance that after a few days you will contract this disease again. Okay. And at some point in time, your partner will also develop symptom and they will come to know that they have this disease. Okay. And then they will come to know that they have gotten this disease for you, and this can be, and you can be in a worse situation. For example, if it is HIV, then they can legally do a court case on you, and you can even end up in prison. So it would be better if you inform your partner. Are you allow us to inform your partner to the partner notification program? Now, please remember that do not mention the prison and the court case in every sexually transmitted diseases. Okay, it's not like someone can do a court case on a partner with gonorrhea. It's just for HIV. All right. So for the other sexually transmitted diseases where you are not suspecting HIV, you just tell them that they at some point in time they will know, and then you can be in a lot worse situation. All right. And it's good for you as well, because if your partner get treated now, then you will both will be free of the disease, and you won't have to come again and again and take antibiotics again and again, which can be harmful for your health. So that was all about confidentiality. If you have any questions about any of the cases, any confusion, do let me know.